Welcome everybody. Two things that's very important that I see a lot of registrars struggle with. The first one is taking a focus history and then shared management. This is another major problem I can see that a lot of you struggle. If you're not asking good question, then you're going to get poor answers. You're going to find that it's very difficult to get a focus history. So the question that you need to be asking, that's going to help you progress your consultation. So be selective in the question that you're asking. So we'll go through what sort of question you need to be focusing on. Another reason why your history might not be focused is that you're talking too much, you're clarifying unnecessarily, and you're not moving the consultation forward. So you're just going in circle. And that's a common pattern I see where people, they're just dwelling in the history and it's not focused. They think that they're trying to cover everything and not miss anything, and the history is just going in circle. Shared management, you need to make sure that you're on the same page as your patient. So like this patient who's worried about cancer, but you just reassuring them about a heart problem, you're not on the same page because they're still worried. So that's why you need to make sure that you're on the same page and explain to them, I don't think you have cancer based on the symptoms that you've told me. What I'm thinking is that what you might have is a chest infection because of XYZ. If you're thinking that your management at the moment is quite doctor-centered, then you need to address it at 3 different levels. So sometimes if you're addressing it only at one level, you're not going to be coherent. So you might say the right thing, you might be doing the right thing, but it does not come as a genuine shared management. You're just doing it for the sake because it's not aligned. So you need to work on not just your behavior, how you come across, but the skill as well to develop that. You also need to make sure that your attitude, your mindset is in the right place. Because if you don't think this is important to have a shared management, you're just doing it for the sake of, then it's not going to be coherent. So that's very important slide. Make sure that you align your attitude, your skill, and your behavior. Because everybody can say the same phrase, all right? But if the attitude, the way it's sounding, they don't buy into it, then it's going to show in the way that you're doing it. To be able to share your management, as we discussed, you need to formulate and verbalize a working diagnosis. You need to address the patient's idea, concern, expectation. You have to achieve a shared understanding with your patient. Involve the patient in the management plan and take into account the psychosocial, the occupation, so that you have got a plan that is personalized to that patient, rather than having a generic plan that you could give to every patient who is coming with a headache. So you need to personalize your plan according to the patient's preferences and needs. And when you're discussing a treatment, then you need to explain the pros and cons of the treatment so that the patient can make an informed decision. If you found this video useful so far, you might be interested in, are you ready to take the RCA test? This is a test that you can take where we're going to look at your answers and check whether you're ready to take the RCA based on your mindset, the strategies that you're using, and the consultation skills. The test only takes 60 seconds and you get more insights into your preparation and how ready are you to sit the RCA. All you have to do is click the link down in the description below and you can take the test free of charge. The management plan, I would say to the patient, I appreciate that you're quite worried about endometriosis. I would want to know a little bit more about the friend, because the patient's understanding of endometriosis is probably based on the friend. So she might say, oh, she's been having bleeding, she's having pain, and then I would use that to help me explain why I don't think this is endometriosis, because this is what endometriosis is, and what you've got is more problem with the bleeding. So that would help me a lot in terms of how I get that shared understanding. If you found this video useful, then I'm sure you're going to get a lot from watching this video where I talk about mistakes that registrars make with the RCA. Click the video to watch it. Take care everybody. Bye bye.